Susan was one of the original pioneers of healthcare for the homeless. She started the Healthcare for the Homeless program in New York City, which became Care for the Homeless. A social worker by training, the daughter and granddaughter of Lutheran ministers. She participated in the 1964 Freedom Rides, going from New York City down to Mississippi. And she was one of the first people who I heard consistently talk about racism as a driver of homelessness. So I was very privileged to work with Susan from 1988 until her premature passing in 2004. So I was privileged that she was my mentor for 16 years. This song also represents Susan because it is revolutionary. It's not just radical, it's revolutionary. It was written by Woody Guthrie in 1940. And there were some versions, some verses that weren't released in all recordings that were in this version that you just heard. It also plays to our theme of access. And the definition of access is the ability, the right, or permission to approach, enter, speak with, or use. In other words, you are not shut out. And our theme is that we want to make sure that no one is shut out of healthcare services or is cut out of housing, that everyone is able to enter into meaningful healthcare and meaningful housing. There was a verse in this song that says, "There was a big high wall there that tried to stop me. A sign was painted, said, private property. But on the backside, it didn't say nothing." And this was not in all recordings. That side was made for you and me. We want to make sure that this country, which is a great country, is available, that the riches and the benefits of it are available to everyone, that everyone has access to it. Recently, I heard Peter Edelman speak. It actually was here in DC about 2 weeks ago at the National Law Center on Homelessness and Poverty's annual conference, where the theme was Housing, Not Handcuffs. And he made a reference to John Rawls' theory of justice. And that took me back to my sophomore philosophy class, where we had to read that book. It was published in 1971. It became an instant classic. And it talked about distributive justice. Distributive justice is how are society's goods and benefits to be distributed among its members. And he argued that under conditions of moderate scarcity, if there was a device that he created called a veil of ignorance, if no one knew what their station in life was going to be, if no one knew what their health status was going to be, into which family they would be born, whether they would have an accident in life, if you had none of that, what would most people choose? What would they choose as a framework for distributing access to society's goods and opportunities? And he argued very persuasively that most people would consider what is fair and what is right is that they would say that everyone should have an equal access to society's goods, that they should be distributed evenly. And if it wasn't to be distributed evenly, it would only because there would be some people based upon accident of birth or accidents that they had less than others, and so that they would get more. That would be the basis for everyone not getting an equal amount. FDR created the New Deal, and he said it is to guard against what he called the vicissitudes of life. That some people, upon accidents or having a hard stroke of luck or anything like that, born with a birth defect, that those kinds of things should not permanently lock you out of society or lock you out of society's opportunities. So he created Social Security as a guard against that. And this is so important because what Peter Edelman said is that we are not only, it seems, at a time just as it was in 1940 when Woody Guthrie wrote This Land Is Your Land, not only at a time of great inequality where we were debating the New Deal, He said, it seems like we are debating the New Deal again, not just the Great Society. Guthrie wrote, "One bright sunny morning, in the shadow of the steeple, by the relief office, I saw my people. As they stood hungry, I stood there wondering if God blessed America for me." Right now in this country, we have a false sense of scarcity. There is not scarcity in this country. From California to New York to the Gulf Stream waters, we have an abundance. America is as rich as it's ever been. We are, by some measures, the richest country in the history of the world. There is not a lack of resources, but we have a manufactured false sense of scarcity. And that is because of a maldistribution of the goods and opportunities in our country. I was reminded by Barbara Di Pietro that we have 20 million people uninsured for health care right now, and yet as a nation we choose to subsidize employer-offered health insurance to the tune of $250 million a year. $250 billion a year. 60% of America's housing subsidies goes to homeowners who don't need it to keep a roof over their head. It's not going to make a difference of whether they have their basic necessities met or not. What it means is whether they will have a bigger house or not. At the same time, we only fund housing subsidies for 1/4 of poor families that need it. So when we are told that there's not enough to care for, to provide housing for everyone, that is a false, manufactured sense of scarcity. The richest 55,000 households get as much as the bottom 90 million households in housing subsidies. That is not a lack of resources, that is a maldistribution. Of major industrialized nations, the U.S. is now near the bottom in social mobility. And this has changed just since the 2000s, and is tied to tax policy. Also around the time that Guthrie wrote that song, Langston Huston in 1935 penned, think of the paraphrase, think of this, the parallels, "Let America be America again." Let that sink in. Let America be America again. And he wrote, "Oh, let America be America again, the land that never has been yet, and yet must be, the land where every man is free, the land that's mine, the poor man, Indians, Negroes, me, who made America, whose sweat and blood, whose faith and pain, whose hand at the foundry, whose plow in the rain, must bring back our mighty dream again. Oh yes, I say it plain, America never was America to me, and yet I swear this oath, America will be." What can explain this maldistribution? Americans, as I'm learning as I've traveled a lot in the last month across this country in my new role, and I look forward to more and visiting more projects, Americans are generally a good-hearted people who want to do what's fair. So if they don't subscribe to John Rawls' philosophy, what do they subscribe to? And I think too many people subscribe to the notion, and it's understandable, that the distribution of goods should be based upon merit. You should get it because you earn it. And this could be a fair way to look at it, but it's not accurate, even if it were a fair way. Poverty exerts a mental tax. So it's not that your kids are smarter than a poor person's kids. It's just that they've had privileges and are able to use their brains, and they're freed from burdens that others haven't had to do. We are not competing on equal ground. My kids don't deserve to get the benefits that a poor person's kids or a homeless person's get because they are better. No, it's not because of their merits. All of us have been helped by others. None of us have pulled ourselves up by our own bootstraps, but many of us have gotten a lot less help than others. To argue that it should be merit is not really a logical argument consistent with the facts. Of the things that lead to poverty, age, gender, geography, education, and race, at least 3 of those are out of anyone's control. At least 3. So to argue that you should only get what you deserve, or everything that you have earned, you deserve it, is not accurate. Not only is it not logically defensible, it's not a fair way to view it. The only fair way to determine, how, in my point of view, how we should distribute wealth in a land where we have an abundance is to view healthcare and housing as human rights. I argue that's not only consistent with logic, and it's not only consistent with morality, it's also consistent with the ideals upon which this nation claims to be founded. The U.S. Constitution says, we the people, the preamble says, we the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty. To ourselves and our posterity, do ordain and establish this Constitution for the United States of America. It says they're establishing government to not only perfect a more perfect union, but to establish justice, to promote the general welfare, and to secure the blessings of liberty upon us and future generations. The Declaration of Independence says, we hold these truths to be self-evident, that all men, we now know, all people are created equal, that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. It says that by basics of being human, there are certain rights that you have, and these are unalienable rights. This is our founding documents. This is what true patriotism would argue, that we care for the people of this country, that government was established to promote those rights. Life, liberty, and the pursuit of happiness. How can we have life without health care? How can we have life and liberty without housing or the pursuit of happiness? Government was as established, it goes on to say, to secure these rights. Not just to protect them that already have them, but to promote them and to ensure that everyone has those rights, just on the basis that they are human beings created by their Creator. So I will conclude with saying that we must fight to ensure that healthcare and housing are human rights. And I say this in a nonpartisan way with every fiber of my being. I don't care if this was done by President Sanders or President Obama or one of the President Clintons or President Kennedy. If anyone wants to take away access to housing, we must fight against it. If anyone wants to take away housing, access to health care, we must fight against it. We already have 20 million people without access to housing. If any administration proposes, or any member of Congress, or any legislature proposes to take away 23 million more, that's immoral, that's unfair by any standard. If you want to take away access to housing, where we have only 1 in 4 people who qualify for housing in a land of plenty, and you want to promote taking away 250,000 more vouchers from families, that is unacceptable. That is unfair. That is unjust. And this is in a land where we choose to spend on our military more than the next 6 largest countries combined. And we're talking about increasing it by another 10%. Dwight Eisenhower, General and later President Dwight Eisenhower said, every gun that is made, every warship launched, every rocket fire signifies, in the final sense, a theft from those who hunger and are not fed, those who are cold and not clothed. This world in arms is not spending money alone. It is spending the sweat of its laborers, the genius of its scientists, the hope of its children. The cost of one heavy bomber is this: a modern brick school in more than 30 cities. It is 2 electric power plants, each serving a town of 60,000 people. It is 2 fine, fully equipped hospitals. It is some 50 miles of concrete pavement. We pay for a single fighter with a 500,000 bushels of wheat. We pay for a single destroyer with new homes that could have housed more than 8,000 people. This is not a way of life at all, in any true sense. Under the cloud of threatening war, it is humanity hanging from a cross of iron. Power concedes nothing without a struggle. Dr. Bradford, earlier today, a winner of the award named after our dear friend John Logier, said, as a physician, she has privilege, and she will use her privilege on behalf of others. All of us in this room, whether we are physicians, social workers, whether we are formerly homeless, whether we are currently homeless, but now advocating, we have privilege over many other people, and we must use it to fight for health care and housing as human rights. If not us, then who will do it? If not now, then when? Thank you very much.